All right, welcome everyone to another deep dive. Today we're going to be taking a closer look at the incredible world of your heart and the vessels in your neck. We've got a lot of great sources lined up, stuff about the heart's actual structure, the ins and outs of blood pressure during pregnancy, all those changes, and even how heart sounds can differ from person to person.
And for all our listeners out there, if you're someone who wants to get a really good grasp on this stuff quickly and efficiently without getting lost in the weeds, you've come to the right place. This is kind of your express lane to understanding the essentials of how your heart is put together, how it works, and the ways we can actually assess it, like through feeling and listening. Plus, we'll be diving into some super important points about blood pressure during pregnancy, what to watch out for, how to manage it, all that.
Okay, so let's jump right in. Our sources all seem to agree on one thing. The heart's location might be a little surprising. Forget dead center in your chest. It's more like an upside-down triangle, right?
Yeah, that's right. And it's nestled between your second and fifth intercostal spaces. So picture the spaces between your ribs, that's where we're talking about, and then from the right edge of your breastbone all the way to about the mid-clavicular line on your left. Definitely leans to the left.
But here's the thing that really caught my eye in the research. It's not just sitting there all straight and symmetrical. It's actually kind of twisted.
Right. So imagine this. The right side of your heart, which is dealing with the blood that's coming back from your body and needs oxygen, it's actually facing more towards the front of your chest. But the left side, which is the powerhouse pumping out the oxygen-rich blood, that's more towards the back. And this whole twisting thing, it's like a key reason why when doctors listen to your heart or feel for pulses, they're doing it in very specific spots.
That makes so much sense now. It's like all connected to how we actually assess the heart. And speaking of assessment, let's talk about palpation. That's just using your hands to feel right.
Exactly, using your hands to gather information. And to do this effectively, you've got to know the landmarks, the lay of the land. You've got your mid-sternal line running straight down the middle of your chest, then the mid-clavicular line, which drops from the midpoint of your collarbone, and finally the anterior axillary line extending down from your armpit. These are like your guideposts to find the intercostal spaces, which you count down from the top of your chest, and that's how we pinpoint specific areas related to the heart.
So it's like a coordinate system for your chest.
Yeah.
Cool. So what kind of information can you get just from feeling around on the chest wall? I mean, what are you looking for?
Well, tenderness, for one. That's often a sign of some kind of inflammation or maybe an injury in that area. But we're also looking for what are called heaves or lifts. Imagine this. You're feeling the chest, and with each heartbeat, there's this distinct outward push against your hand, almost like the heart is trying to lift your fingers. That kind of forceful thrust, it often means that a ventricle, one of the heart's pumping chambers, is enlarged or working too hard.
And then you've got thrills. That sounds a little intense.
It does, right. But actually, a thrill is basically a vibration that you can feel through the chest wall. Some of the sources we looked at actually compare it to petting a cat when it's purring, that sort of buzzing feeling. That's what we're talking about. And it usually means that there's turbulent blood flow happening in the heart, which could be due to a heart valve issue. Maybe it's narrowed or leaky, or there could be a problem with one of the major blood vessels.
So while a cat's purr is pretty nice, you probably don't want to feel that in your chest. Now, let's talk about the point of maximum impulse, the PMI. Where exactly are you feeling for that?
So the PMI, that's basically the spot on your chest where you can feel the heartbeat most strongly. You typically find it in the apical area, which, as we talked about earlier, is around that left mid-clavicular line in the fifth intercostal space. And for this, you want to use the pads of your fingers and apply a gentle but firm pressure.
Gotcha. And what can the way the PMI feels tell you about the heart? I mean, are there different types of PMI?
Yeah, the characteristics of the PMI, they can tell us a lot. Normally, it should feel like a quick, light tap against your fingers. But if it feels sustained, meaning it's longer than a normal tap, it might mean that the left ventricle is working harder than it should be. Maybe it's enlarged or thickened. That's what we call hypertrophy, and it's often seen in people who've had high blood pressure for a long time, or those with a narrowing of the aortic valve.
Okay. And then there's diffuse. I'm guessing that means it's spread out.
Exactly. A diffuse PMI means you're feeling the impulse over a larger area than usual. It can indicate that the ventricle itself is dilated, which is when it's kind of stretched out and enlarged. This can happen in things like congestive heart failure, where the heart muscle is weak, or in cardiomyopathy, a disease of the heart muscle itself.
So feeling around the chest can tell you a lot. But I know palpation is also used for the peripheral circulation, right? Not just the heart itself.
Absolutely. We use it to assess the pulses in your arms and legs. It helps us determine how well blood is flowing to the tissues. And we can also check for edema, which is just a fancy word for swelling, which can be a sign that your body is holding on to too much fluid.
And which pulses are the ones you typically check?
Well, there's the carotid artery in your neck, the brachial in your upper arm, the radial in your wrist, the femoral in your groin area, the popliteal behind your knee, the posterior tibialis behind your ankle bone, and finally the dorsalis pedis, which is on the top of your foot. It's like a road map of your arteries that we can actually feel.
That's pretty amazing when you think about it. And it's not just about finding the pulse, right?
Mm.
The way it feels is also really important.
Right. When we're checking those pulses, we're paying attention to three things: the rate, which is just how many beats per minute. Then there's the rhythm, are the beats regular or not? And finally, the quality or the strength of the pulse. And we usually compare the pulses on both sides of the body, left and right, to see if there are any differences. The only exception is at the carotid arteries in the neck. We don't want to press on both of those at the same time because it could affect blood flow to the brain.
Makes sense. So how do you describe the quality of a pulse? Is there a system for that?
Yep. There's a scale that we use. It goes from 0 to 3. A 0 means you can't feel the pulse at all. It's absent.
Yeah.
A 1 means it's there, but it's weak. It's diminished. A 2 is what we consider normal. It's easy to feel. And then a 3, that's an increased or bounding pulse, meaning it's really strong.
Okay, so that gives us a good overview of how using your hands to feel, palpation gives us important information about the heart and circulation. Now, I want to move on to something that was really emphasized in our sources: blood pressure during pregnancy. I know a lot changes in the body during pregnancy.
Oh, absolutely. Pregnancy just triggers this incredible chain reaction of adaptations. And vital signs, things like heart rate and blood pressure, they definitely change too. One of the common changes is that the resting pulse rate often goes up, usually by about 10 to 15 beats per minute. That's because there's more demand on the circulatory system, for both the mom and the baby.
And what about blood pressure? I feel like we hear so much about that during pregnancy.
You're right, it's super important for prenatal health. The interesting thing is, many pregnant women actually see their blood pressure dip a bit compared to before they were pregnant, especially during the second trimester. It's probably because of hormonal changes that relax the blood vessels. However, we still have to monitor blood pressure throughout pregnancy very closely because any major changes could mean there's a problem for the mom or the baby.
Now, our sources break down the different types of blood pressure issues that can pop up during pregnancy. Can you walk us through those?
Sure. So first up is chronic hypertension. That just means high blood pressure, readings of 140 over 90 or higher, that was already present before the pregnancy or diagnosed before the 20th week. Then you have gestational hypotension. This one pops up after 20 weeks in someone who had normal blood pressure before. And the important thing is there are no signs of organ damage or protein in the urine.
Okay, so that's a key distinction. And preeclampsia, that one sounds a bit more serious.
Preeclampsia, yeah, that's definitely more serious. It also develops after 20 weeks, and it involves high blood pressure. But there are also signs that the high blood pressure is affecting the organs. This could be protein in the urine, problems with liver function, or a low platelet count. It's basically a sign that things are getting more complicated.
And then there's eclampsia, which is like the next level of severity, right?
Exactly. Think of eclampsia as a severe form of preeclampsia, but with seizures on top of everything else. It's a real medical emergency that needs immediate attention.
Wow, okay. And I know our materials also mentioned hypotension, which is low blood pressure. What are the common causes for that during pregnancy?
Well, those hormonal shifts we talked about earlier, they can cause the blood vessels to widen, a process called vasodilation. That can lead to lower blood pressure. Also, as the uterus grows, it can actually press on the inferior vena cava, which is the large vein that brings blood from the lower body back to the heart. This is especially true when the pregnant woman is lying on her back. So that compression can make less blood return to the heart, and that causes the blood pressure to drop, sometimes leading to dizziness or even fainting.
So many things can affect blood pressure during pregnancy. Are there any specific factors that make a woman more likely to have high blood pressure?
Yeah, there are definitely some risk factors. You can kind of divide them into two groups. Things about the mother herself, and then any pre-existing medical conditions or history. So maternal factors would be things like it being her first pregnancy, being under 20 or over 40, having a BMI over 30, a family history of preeclampsia or gestational hypertension, carrying multiples like twins or triplets, or having pre-existing conditions like diabetes, kidney disease, or autoimmune disorders.
Okay, so a lot to consider there. And what about medical history specifically?
Well, If a woman had a high blood pressure in a previous pregnancy, that's a big red flag. And then a history of thrombophilia, which is a clotting disorder, or if the pregnancy was achieved through IVF, those things also increase the risk of high blood pressure.
It sounds like monitoring is absolutely key given all these potential risks. What are some of the serious complications that can happen if high blood pressure isn't managed during pregnancy?
It can be really serious for both the mother and the baby. For the mother, uncontrolled high blood pressure could lead to a stroke, damage to the kidneys or liver, placental abruption, which is when the placenta detaches from the uterus too early, and HELLP syndrome, which is a serious complication that affects the blood and liver.
And what about the baby?
For the baby, it increases the risk of preterm birth, low birth weight, stillbirth, and something called intrauterine growth restriction, or IUGR, which means the baby isn't growing as well as it should inside the womb.
Those are some really serious consequences. So what are the strategies for managing and even preventing high blood pressure in pregnancy?
The most important thing is good prenatal care with regular blood pressure checks at every appointment. Lifestyle changes are also crucial, like a healthy diet with less sodium and plenty of fiber, protein, and potassium, regular exercise that's okay by the doctor, and learning how to manage stress. Sometimes medication is needed to lower blood pressure, like labetalol, nifedipine, or methyl-dopa. Those can help manage the condition and reduce the risk of complications.
That's incredibly important information. Okay, let's shift gears a bit and talk about another key part of cardiac assessment. Listening to the heart sounds. Everyone knows the basic lub-dub, right? That's S1 and S2. What exactly is causing those sounds?
So the first heart sound, S1, the lub, that marks the very beginning of systole, which is when the ventricles, the heart's pumping chambers, contract to push blood out to the body and lungs. S1 is mainly caused by the mitral and tricuspid valves closing. Those are the valves that separate the upper chambers, the atria, from the ventricles. Then you have S2, the dub, which happens at the end of systole as the ventricles start to relax and refill with blood. S2 comes from the aortic and pulmonic valves closing, and they stop blood from flowing back into the ventricles.
So a nice, clear lub-dub. That's what we want to hear. But there are also extra heart sounds like S3 and S4. What do those tell us?
Those extra sounds, they can actually give us clues about what's going on with the heart. S3 happens very early in diastole, right when the ventricles are filling up quickly. It usually means the ventricles are having a bit of trouble handling all that incoming blood. In adults, an S3 can mean there's increased volume in the ventricles, and it's often heard in people with congestive heart failure. S4, on the other hand, happens later in diastole, right before S1. It's caused by the atria contracting really hard against ventricles that have become stiff. And S4 can sometimes be heard in things like pulmonary hypertension or hypertrophic cardiomyopathy.
And then there are heart murmurs. Those always seem to be a bit of a worry when they're discovered.
Yeah, a heart murmur is just an unusual sound that we hear during the heartbeat. The thing is, the period between S1 and S2 and also the period after S2, they should be pretty quiet. A murmur usually means there's something disrupting the normal blood flow, often because of a problem with one of the heart valves. Maybe it's narrowed or leaking, and that creates turbulent flow.
So quiet between the lub-dub is a good thing. All right, last thing I want to touch on is some of the normal variations we might see in children's hearts. Obviously, a newborn's cardiovascular system is still developing.
Oh, for sure. Right after birth, a baby's heart rate is much faster than in older kids and adults, usually between 100 and 180 beats per minute. Their system is still adjusting to life outside the womb.
That's such a difference. And I remember reading about a specific murmur that's common in newborns.
You're probably thinking of the murmur that comes with a patent ductus arteriosus, a PDA. It's a continuous murmur that we actually expect to hear in the first couple of days of life. So the ductus arteriosus is a blood vessel that connects the aorta to the pulmonary artery in a fetus, and it allows blood to bypass the lungs, which aren't working yet. After birth, it normally closes up on its own within the first day or two, and once that happens, the murmur disappears too, usually by 2-3 days of age.
Okay, that makes sense. So apart from that, what are some signs in children that might make you think there could be a heart problem?
There are a few things. Poor weight gain or developmental delays, those can be linked to heart issues because the body isn't getting enough oxygen. If a child has a constantly fast heart rate, that's tachycardia, or rapid breathing, which is tachypnea, or shortness of breath when they exert themselves, those are red flags. And then cyanosis, that bluish tinge to the skin, especially around the lips and fingertips, that's a sign of low blood oxygen. Clubbing of the fingers where the nail beds get thick and rounded can also be a sign. And of course, if you see any bulging or forceful movements of the chest wall, that's not normal in a child and it needs to be checked out.
It's interesting that an S3, which can be a problem in adults, is actually normal in kids.
Yeah, a physiologic S3 is pretty common in children and young adults. It doesn't mean anything's wrong. It just has to do with the way the ventricles fill up quickly during diastole in a healthy heart.
What about sinus dysrhythmia? I think we saw that in the sources too.
Oh yeah, sinus dysrhythmia, it's totally normal, especially in kids and young adults. It basically means the heart rhythm changes a little bit with breathing. The heart rate speeds up a tiny bit when you breathe in and slows down when you breathe out. It's a good sign that the autonomic nervous system is working well.
Wow, this deep dive has been incredibly informative. We've covered so much about the heart and neck vessels.
We really have, from the heart's unique anatomy and how it sits in the chest, to using palpation to learn about how it's functioning and checking the circulation. And of course, all the important things about blood pressure during pregnancy, the different types of hypertension, the risk factors, how to manage it, all that. We even got into the different heart sounds, normal and abnormal, and then some specifics about the cardiovascular system in kids.
It's amazing how much information can be gleaned just from listening to and feeling the body.
Yeah.
This deep dive has definitely given us a great foundation for understanding these complex but vital topics.
It really has. And to all our listeners, we hope this has given you some valuable insights into this amazing and essential part of your body.
And on that note, here's a little something to think about. We've seen how dynamic the cardiovascular system is, and how different factors, whether it's pregnancy or even just breeding, can affect how it works. So what other subtle cues from your own body might be telling you something about your overall health? It's a good reminder that our bodies are constantly sending us messages if we pay attention. Thanks for joining us for this deep dive.